Well, thank you very much for that welcome. One of the things that wasn't mentioned is I am a nurse. I'm also a nurse practitioner. I practice every weekend as an acute care nurse practitioner in a large health system in Philadelphia. I work 7 A to 7 P every weekend. In addition to that, I'm adjunct faculty for Drexel University in our graduate and doctoral programs as well. So I am one of you. I'm a nurse, just like you. So let's talk about this whole business of healthcare and what it really means. What is healthcare? Healthcare is the business of taking care of people. It's about caring. It's about caring for people at the best times of their lives and the worst times of their lives. I work in critical care. Nobody wakes up in the morning and says, hey, I'm going to go to the ICU today to spend the day, or I'm going to take a trip to the emergency department. So we care for people at their most vulnerable times, and we do it with dignity and respect. But it's a challenge. The biggest challenge in healthcare today, whether I'm here in Australia, I'm talking to people in the United States, whether I'm visiting small rural hospitals in Africa or in South America, the biggest challenge we have is being able to provide evidence-based, cost-effective care that'll improve practice and improve patient outcomes. How many of you would agree that is our biggest challenge today? Yeah. And it becomes more and more difficult because we are under a deluge of research that is being thrown at us. Over 2 million articles are published annually. So you could sit at a desk and read journals 7 days a week, 24 hours a day, and you would not be able to keep up with the latest evidence. In addition, which makes your job really difficult, is that there's a 17-year lag between getting research into practice. Now, I don't know about you, but if I'm here in a hospital on the Gold Coast, I would like you to provide care to me based on today's standards, not something that happened 15 years ago. How many would you agree with that? Absolutely. So when we look at this whole thing about healthcare and we look about evidence-based practice, one of the things we need to ask is, what is your country's resources? What's their health focus? Because it really differs country to country. We take it for granted that you can go to the grocery store and buy food, fresh food. You take it for granted that you turn the light switch on and the electricity works, that you have clean water, that you have sanitation. But it's very difficult for us to speak to people about healthcare maintenance and improvement when they have dysentery because they have a poor water supply that's contaminated. You're lucky here. You have access to a lot of the latest medical updates that are going on. Some of the brightest minds in the world are right here in Australia. You have access to all the latest medications. But that's not true globally. And as you see in this person right here down in the bottom right, he has now had to step back from the science of what we do to going back to the art and using our senses and remembering that using our hands and our ears and really taking care of the patient is very different without all that technology. Now, how many of you go to see a healthcare provider on an annual or every other year basis just to check in and talk to them about how you're going to improve your healthcare? How many do that? Very few. Congratulations, you're all members of the disease episodic model of care, which means you don't go and talk to a healthcare professional, a nurse or a physician, about staying well. That's a problem. I had the opportunity to speak in front of the UN a few years ago, and it was very humbling to be able to do this as a nurse. And they asked me, Ann, what is the magic bullet? What is the magic pill? And I said, there isn't one. It's all about disease prevention and maintenance. So globally, we need to start the shift from the disease episodic model of care, and we need to start looking at the determinants of health, which look at what are the resources that patient has available to them to improve their health care. What's their economic status? Now, I happen to work with a lot of patients who have myocardial infarctions, and I do a lot of smoking cessation training with them. And it's a problem Because if they're going home to a whole family that smokes, do you really think they're going to stop smoking? Absolutely not. So now the quality care we deliver has to now include taking care of the family. So that definition of patient that we have as one person is wrong. We're taking care of multiple people. We're taking care of communities. And only doing that are we going to be able to shift where we have this whole idea of wellness, where we keep people out of the acute care setting. We keep them healthy. So some days as a nurse, you may have a lot of time to spend with your patient. But I would say to you, the reality is here on the right. Chaos. Controlled chaos. How many of you would agree with that who work in acute care? Absolutely, right? You spend over 50% of your time nursing or caring for the electronic healthcare record and the technology and not paying attention to the patient, right? Because you have to do all your documentation. How many of you would agree with that? We have to change that. Nurses have to be at the table when decisions are being made about what technology are coming into healthcare institutions. We have to have a voice when we're working with manufacturers who are building these electronic healthcare records and all this other technology that we deal with for our patients. Because frankly, it's taking us away from what we care about the most, and that's caring for people. And we all know that having access to the best available evidence is going to improve healthcare outcomes. Now, you all are aware of this, what evidence-based practice is. It's using the best available research evidence, pairing it with your clinical expertise, what you bring to the bedside. Those of you who have been nurses for 5, 10, 15 years, I've been a nurse for over 34 years, which is a little scary. I started when I was 10. But we take our clinical expertise, and then we combine it with what the patient wants. Because no matter what we do, no matter what a research study says, if that's not what a patient wants, it's not worth it. We need to stop and ask the patient, what is your definition of quality of life? And only if we pull these three things together are we really practicing evidence-based practice. So we need to make sure that our healthcare institutions adopt a healthcare evidence-based practice methodology. And it's actually very simple. And people try to make this really, really complex because there's many, many different evidence-based practice methodologies. But when you really boil it down, all it is you need to ask a clinical question. You got to search to find the best evidence. You have to appraise that evidence, because not all evidence is created equal. You have to implement it, and now here's the caveat. You have to evaluate whether what you've done has made a difference, because there's a lot of things that we do in nursing that don't help our patients. How many of you remember the days when we had wound care and we put heat lamps on wounds? Anybody remember that? We were cooking patients. That's not good. How many of you that work critical care remember you have a patient who was intubated on the ventilator, you flush down saline down their endotracheal tube every 2 hours, whether they needed it or not? How many remember doing that? Guess what? Research was done. You know what we were doing? We were drowning the patient. Not what we're supposed to be doing. So we need to evaluate whether the things we put in place under the name of research or evidence-based practice really do make and deliver good outcomes. We need to make sure that as nurses, we have access to all the healthcare information and literature that's out there, because we work in this body called healthcare. It's not nursing. Let me give you an example. You have a patient that falls, fractures their hip, you have to get them up and ambulate them. You're not going to find that information in the nursing literature. You're not going to find it in the medical literature. You're going to find it in the physiotherapy literature. If you as a nurse don't have access to that information, that you're not going to be able to provide the best care to your patient and improve those outcomes. So why do we use evidence-based practice? Well, we use it because research shows us it does help deliver better outcomes, and it helps to reduce costs. How about that? Doing the right thing right will actually save you some money in a healthcare institutions. It makes complete sense. But there's a big problem in healthcare today, and it's called variability of care. What does that mean? It means if I'm here in a hospital on the Gold Coast, and I have my myocardial infarction, and I go to a hospital down the street, I may get a different level of care. It may happen within our wards in one hospital. That is wrong. Our patients deserve better, and we need to change it. And if I have my myocardial infarction here, and I go home and have it where I live in Philadelphia, I should be able to receive the same standard of care based on the resources available. So we do know that variability care can do a few things. It can reduce waste and cost, it improves patient safety, and it optimizes outcomes. So how do we do it? How do we change patient outcomes? Well, one of the most important things is we have to have the right resources when and where we need them. And that's at point of care, point of reference, and point of learning. Point of care is when you're right there with a patient, you have to make a clinical decision. You need some information to give you that clinical decision support. That's very different type of information than reading a journal article or research study. Those are considered point of reference. Those are what our quality improvement people are reading, our faculty are reading. Those who are developing the policies are reading. But you as a bedside nurse at point of care, you have 30 seconds to just a few minutes to make a decision about your patient and instill that intervention. You can't do that reading a journal article, and I'm going to use my own journal, the American Journal of Nursing. You can't do it. But we also need to make sure that not only do you need the right resources at point of care and point of reference, we have to have the right resources at point of learning. And point of learning includes two things. Number one, it includes when you learn to become a nurse, when you're a student. Those resources need to be very, very different. But then we need continuing professional development as nurses to make sure that we are always practicing at the highest level. And CPD has become very, very important to our licensure and to our accreditation and our professional development. One of the things that we've done at Wolters Kluwer is we absolutely really believe in this whole concept of providing information for the right reasons and to improve patient outcomes. So we have involved some partnerships, and I'm proud to say that we have actually partnered with the Australian College of Nursing to localize one of our point-of-care tools, Lippincott procedures. So we're very, very proud of that relationship, and thank all of you from the Australian College of Nursing for making that happen. We're actually localizing the procedures for you here in Australia. So that's very exciting. But we also know, and we firmly believe that continuing professional development is so important. So one of the things we've done is partnered with OSMed Education. And so we're going to give credit through OSMed, CPD credit, for when you use Lippincott procedures or some of our other tools eventually, that if you use it and you take a test within Lippincott procedures, you'll get CPD credit. Because it gives you an incentive to continue learning every day. So in the end, it's really all about caring for people. Those people are the people sitting next to you. It's your family, it's your parents, it's your children. It's all about caring for people, and that's what we do better than anyone. When patients are sick, they come to us. It is nurses that are the backbone of acute care and healthcare and primary care. We are the ones who provide the care and the education to the patients. Medicine does a great job with what they do, but we as nurses, we lead that charge because we are all about improving patient outcomes. And as I said before, the way to do it is through lifelong learning, so I'm going to leave you with this video.
Today's nurse. An empowered individual with the ability to pursue his or her own professional potential through a cycle of ongoing, self-motivated learning along the journey of his or her career. We know that each and every nurse is on a different and very personal journey, and all must be equally supported in their individual pursuits. Each individual nurse is empowered to change their own behaviour to address each patient's unique needs. To improve patient outcomes, each nurse needs ready access tools designed to nurture a culture change in their own unique environments, no matter where they are personally, professionally, or geographically. For example, an experienced nurse might need evidence-based point-of-care resources to help with procedures and caring for patients with certain diseases and conditions. point of learning resources for evidence-based clinical competency validation and professional development, and point of reference resources for research or information to be used for policy and procedure development. On a different track, a novice nurse will need evidence-based point of care resources to help with step-by-step guidance for procedures and support in clinical decision-making for diseases and condition nursing care. And also point of learning tools for initial and continuing education and professional development, and so on. And only through this kind of individual empowerment can necessary change be driven to support the greater global health system. The concept of lifelong learning, a dynamic process which encompasses both personal and professional life, is both formal and informal, and involves the seeking and appreciating of new worlds or ideas to gain fresh perspective, knowledge, skills, and interactions. It was first introduced in a report from the Institute of Medicine calling on nurses to take a greater role in an increasingly complex healthcare system. It starts with you. One nurse, one community, one global health. Wolters Kluwer, when you have to be right.
So I just want to say thank you. Thank you for being the ambassadors for the profession that you are. Thank you for what you do every day, whether you're at the bedside, whether you're teaching nurses how to be nurses, or whether you're in administration. What you do is valued and makes a difference, and we're doing it one patient at a time. Thank you very much.